What's up everybody, Doc John here from Mobility Doc, and I want to go over hip cars with you today. I often see them done in quadruped or on all fours, but I've been running a lot for the last 2 years working on sprinting, and I've found that standing is one of my more favorite ways of doing it. You know, hip cars stands for controlled articular range of motion. The exercise itself is phenomenal for restoring range of motion throughout the entire hip, and we here at Mobility Doc are really big fans of movements that take you through larger full ranges of motion. There is a time and place for an isolated stretch. We would say that it's good to have some isolation, but you definitely want to teach the joint how to move through its full range. And you know, as mobility is flexibility, stability, and strength, hip cars are a great way to train that flexibility, stability, and strength. And strength being, in this case, sort of neuromuscular control, your brain's ability to make sense of the use of that full range and find movement. So without further ado, let's get into the hip car. So as you can see here, I've got a box. This is just a regular old-fashioned Titan box jump. It's a soft box. If you've never seen those Titan boxes, they're pretty great because you can't destroy your shins when doing box jumps. So let's get into the cars, right? If the box is on my right-hand side, I'm gonna be working on my right hip. Now, a few really important pointers that if you do not follow, you will just be wasting your time. You do not want to begin with too high of an object, and you should use an object. Without that, what I find is people like overshoot or undershoot the range. They're inconsistent. I like this consistency. Using a box or a bench or a bunch of weights stacked on top of each other is an excellent way of gradually increasing your range of motion and being able to measure that as you improve. I do this for sets and reps typically. I have my patients do this for sets and reps. So using an object makes it easier to keep track of your progress. The reason why I don't want you to go too high is that it's important that you don't start tipping your hip and doing funny things on the other side. You want to try to get as much of the range of motion through just your hip as possible. So if you're moving through other places, you're not really benefiting at the hip at all. Part of this is going to be a stability exercise on the contralateral or opposite side. What I like to do is arbitrarily start with my leg forward and then I bring it back around. You could have your hands on your hips. You could just have them at your sides. I'll put them at my hips just to get them out of the way a little bit for you. What you're going to do is you're going to bring that knee up to clear the box, right? Then you're going to clear around. Then I'm going to rotate internally, squeeze my glute, bring my leg down. Now I'm going to do the opposite to bring it back around. So I'm going to extend from my hip. I'm going to now start to externally rotate, bring that foot through and down. And sure, am I perfect? No. Are my hips the most perfect hips in the world? Absolutely not. That's why I'm doing this. That's why you're going to do this. So again, I'm going to bring my leg up. So just straight flexion. Now I'm going to bring it away from my body. I'm going to internally rotate and bring the leg down. Now I'm going to extend. I'm going to clear and bring it back in front of me. You can put your foot down for each one, or you can keep the leg up. So if I do this in a little bit more real time, I'm going to bring it out, back, down, back, out, down. And you can see the box keeps me honest because if I keep my foot too low, I'm just kicking it. If I put it down too soon, then I feel that. It also gives me some feedback. I can feel this big time on my left side, by the way, as I'm trying to not move from my left side and not kind of hula hoop around. I can feel that working. So again, I like to do about 10 reps of these on each side, working on trying to even out left and right. If your balance is not so great or you're really struggling, it's less about quantity as it is about quality. So I would still stick with like 3 sets as a minimum, but you might find that you're more in the 5 rep range on each side and increasing that as you improve. If you have any questions or comments, concerns, put them in the comment section below. Let us know if you're having any difficulty or you want to know more about this. I appreciate you. Thank you for watching. I'm Doc John from Mobility Doc. Until next time.